Next, we have the Aspergillus. So, Aspergillus fumigatus on inhaling, it causes like irritated airway, and if you see, there will be damaged cilia and increased mucus production, excess mucus production will be there. So, it is a ubiquitous saprophytic mold, high sporulating capacity. It releases conidia at high concentrations, that is 1 to 100 conidia per millimeter cube into the atmosphere. And this conidia has 2 to 3 micrometer, which invades the alveoli, causing severe infection among immunocompromised individuals. So, this conidia directly reaches the alveolus. In the alveoli, it causes severe infection in immunocompromised individuals. And then the filamentous septate, which is narrow, that is 3 to 6 micrometer hyphae with acute angle 45-degree branching is seen. So, this is features of Aspergillus fungi and about its septate and the number of conidia, the diameter, and also about the high sporulating capacity of Aspergillus. So, for detecting Aspergillus, we do fungal KOH mount, then GMS staining and PA staining. So, this is how it is looking in the each stain. Next, we have the Aspergillus species and the different types of Aspergillus species. There are 200 Aspergillus species were found. Only 20 have been encountered as pathogenic in humans. So, only 20 of them are pathogenic. Some of the pathogenic organisms are Aspergillus fumigatus, which is the most common. Then we have the Aspergillus flavus, Aspergillus niger, Aspergillus tertius, Aspergillus nidulans, Aspergillus lentulus, Aspergillus calidostris, Aspergillus glaucus. So, this transmission is by inhalation of spores. So, here is the structure of the Aspergillus. We have the conidia here. Then this is the sterigma, the stem type, and then we have the vesicle here, and then this is the conidophore, okay, and we have a foot cell and hyphae. So, in the slide you can see Aspergillus, this is the structure, microscopic structure. So, all these spores, the transmission is through the spores of the Aspergillus species. So, epidemiology. Immunocompetent host, the Aspergillus species in respiratory secretions reflects colonization and not the infection. And atopic individual, this is the robust immune reaction. So, who are those atopic individuals? Those with allergic rhinitis, asthma, hypersensitive pneumonitis and ABP. And also in pre-existing cavity. So, any cavity, the Aspergillus formation can occur and Aspergilloma formation will happen. And then we have the immunocompromised. In immunocompromised, there can be invasive pulmonary aspergillosis. So, these are the 4 conditions in which aspergilloma can occur. So, there is spectrum of pulmonary aspergillosis. We have the clinical features and immune status and underlying lung architecture and degree of tissue invasion. So, if you see clinical manifestation, if it's a simple colonization, it can be normal immune status. And the underlying lung architecture, they can have COPD and tissue invasion is none. Whereas in hypersensitive reactions like allergic bronchial asthma, ABPA, bronchocentric granulomatosis, extrinsic allergic alveolitis, and all this hypersensitive reaction, there is immune status of primary, okay, it is increased. So, underlying lung architecture, if you see in allergic bronchial asthma, it will be normal. Whereas in ABPA, there is excess airway mucus. And even in bronchocentric granulomatosis, there will be excess airway mucus. But in extrinsic allergic alveolitis, it will be normal. So, in this also, in hypersensitive reactions, degree of tissue invasion is none. There is no degree of tissue invasion in simple colonization and hypersensitivity reactions. Next is the invasive infection. In invasive infection, we have invasive bronchopulmonary aspergillosis. In that, immune status increased and underlying lung architecture mostly in the lung transplantation. And also there will be degree of tissue invasion is 2 degree. And then we have bronchial stump aspergillosis. In this, immune status will be normal. Underlying lung architecture mostly in the pneumonectomy. That is primary 1 degree of tissue invasion. Then we have the chronic pulmonary aspergillosis. In this, immune status will decreased. It can be mostly in the COPD conditions, chronic obstructive airway disease, and that will be 1 degree of tissue invasion. Whereas invasive pulmonary aspergillosis, immune status will be decreased and underlying lung architecture can be normal, but the degree of tissue invasion is 3 degree. So, these are the conditions, is a spectrum of pulmonary aspergillosis.